I'm Dr. Fidelis, a Senior Medical Officer in Infectious Disease / Isolation Center, University of Nigeria Teaching Hospital in Nigeria.
As we all know, February this year, the war broke out between Russia and Ukraine, displacing many Ukrainians and a lot of foreign students from Ukraine, which includes students who are training to become medical doctors. In the recent times in the news, we've seen the Medical and Dental Council of Nigeria and Ghana disregarding the 2022 certificate from Ukraine. These doctors have no chance as it stands now of practicing in their home country or even given the opportunity to prove themselves. Discussing these topics in this series, what is the way forward, and also we consider things like students who continue to study in Ukraine, what are their hopes and what are their chances? Is it wise? Is it not wise to continue your study in Ukraine online? What are the options that are available? Without wasting much of your time, let us meet our guest for today.
I'm Dr. Fidelis, a Senior Medical Officer in Infectious Disease / Isolation Center, University of Nigeria Teaching Hospital in Nigeria. I finished from Ukraine, specifically from Zaporizhzhia State Medical University. After that, I came back to Nigeria to write our Nigerian Medical and Dental Council of Nigeria exam. By the grace of God, I passed, and that qualified me to go for my 1-year compulsory internship, which some people call housemanship. So in the University of Nigeria Teaching Hospital, that's where I did my house job. So after that, I continued with them till date.
Thank you, Dr. Fidelis, and welcome to my channel. And we are very glad to have you here. The first question for you today is, what is your opinion about MDCN not allowing the recent medical graduates from Ukraine to take the licensing exam and have the opportunity to practice in Nigeria?
Okay, like you said, my opinion, I'm not talking about for anybody, like what I think. MDCN allowing Ukrainian 2022 graduates to write the MDCN exam, MDCN licensing exam. Well, looking at my own personal investigation, I have friends in India, so I asked them about their own country, what did they do, what are they saying about their own graduates from Ukraine. So he said that the Indian government doesn't have any problem with it, like their medical council, so they're allowed to write their exams. Although I know that according to Nigerian rule, in their laws and in their regulations, you are not supposed to do your medical practice like as a student, to undergo your medical training online. Of course, we know that medicine is hands-on. It's, apart from being theoretical, that is one practical aspect. You have to see your patient and demonstrate your clinical skills. So, but the final year students were 3 months to graduating. So I think, meaning that for the past 5 years plus, they have been going through their medical training the way it should be, going for ward rounds, going seeing their patients and attending and going for hospital rotation. So I don't think 3 months, the 3 months that the war started that made them to now stop going for classes and they now started studying online. I think 3 months is enough to disqualify them from writing the exam. After all, the exam is supposed to test everyone's knowledge, even if you completed your entire studies the way it should be by seeing your patients and all that. You still have to write the exam. Now, though you'll be given the waiver, or there's some other advantage to that. So I think they should allow them. So those that pass, it means that okay, despite the fact that they finished their 3 months online, that they equally know what they did and what they have done. So I believe they should be allowed to write it, because not allowing them, they are stopped. They can't be. They are not allowed to practice medicine in Nigeria because they don't have the license. They can't go for NYSC. So mentally, it's not good for them mentally. A lot of people could go into depression. Just imagine the financial implications of their parents, what the amount of dollars they have spent The average tuition fee in Ukraine is $5,000 per year. Just imagine the amount they have paid for 6 years, and then for them to have graduated, because they were able to graduate them and all that. And the Nigerian government, or rather the Medical and Dental Council of Nigeria, is saying that they are not going to be allowed to write the exam. So I think the essence of the exam is to sieve out those that are not qualified, or those they feel that are not don't have all the necessary clinical and skills to practice in Nigeria. So they should allow them, and those that make it will be allowed to practice. Those that didn't make it should keep writing. Yeah, that's my opinion.
Yeah.
So my advice to them is they should not lose hope. They should continue to prepare, prepare for the licensing exam as though they are going to write it. They should start going to hospitals for rotations, for clinical rotations, to get acquainted with tropical diseases and how it's being managed in Nigeria. And again, they should equally lobby their representatives in the National Assembly, the House of Representatives, and the Senate. I'm sure that everyone came from a local government, from a constituency. So they should reach out to their representatives to put pressure on the federal government, especially the Ministry of Health, down to the Medical and Dental Council to allow them to write the exam. But then they shouldn't just sit at home and do nothing. They should keep sharpening their clinical skills and their knowledge and go for hospital rotation. And at the same time, equally pray. Prayer is important. I still believe in miracles.
The last question I have for you today will still be somewhat surrounding the conversations that we're having about locally or indigenously Nigerian trained doctors and foreign trained doctors. So as a foreign trained doctor was at times practice and interact with those who went to medical school in Nigeria, what's your assessment? Because I think the question has always been that some foreign trained doctors, especially those that graduated from Eastern Europe, not being up to standard. So I believe that some of these biases or some of these thoughts are mainly the underlying factor to some of these decisions. So let me make it a little bit personal. As a foreign trained doctor, did you ever or do you ever feel inferior to doctors who had their medical training in Nigeria?
Why should I feel inferior to them? Of course, no. It's not true that foreign trained doctors are less qualified or less exposed compared to doctors that train in Nigeria. I don't know, for where I trained, especially in my school, we were allowed to experience everything from theaters to ward round to our interaction with our patients. They allow us to point them. Although, some might have experienced some racism. Maybe once a white patient sees you, you're a black medical student, they might not want you to come close to them. And again, some people that are not good in the local language, they had this language barrier that might have hindered their exposure in the medical practice. Some of the Eastern European countries don't speak English. But for me, I don't think, I appreciate the fact that the doctors, I don't like calling them locally trained doctors. I appreciate the fact that doctors that were trained in Nigeria are equally good too. That does not mean that those in Ukraine, those that were trained in Ukraine, we are less trained or less exposed, because I have colleagues right now presently that are practicing in US. They have written USMLE, they wrote it once and they cleared it and they passed it. They are now practicing in US doing their residency. I have colleagues that are practicing in UK and they are all Ukrainian trained. So I don't get where the issue or the notion that those that are trained in Ukraine, we are not properly trained. Okay, for me as an example, I trained in Ukraine, I came back to Nigeria, did my house mention for 1 year, and I got retained in the hospital where I did my house training. And I'm sure that it has nothing to do with it. There were some criteria that they looked at. It was not everybody that did house job with me got retained in the same hospital. But they saw how how dedicated I was with my studies, how passionate I was with my work rather, and how my interaction with patients and clinical judgment. You know that this is an asset and you cannot afford to lose this one in the hospital. So that's how I got retained in the hospital. That plus every other person. So I appreciate their Nigerian products, Nigerian medical trained doctors, and the foreign ones. So I think we have ideas to share. We have skills to transfer to each other. You know, we got exposed to the the technological and more advanced way of medical practice, unlike what we have here in Nigeria. So I think it's a two-way thing that we are transferring knowledge to them, and they themselves are transferring knowledge to us. So nobody is more superior than the other. Yeah, that's what I think.
Thank you so much, Dr. Fidelis, Chief. Thank you so much for being on my channel. So much encouragement and so much wisdom from you today. I really do appreciate. I'm looking forward to bringing you up here. Probably would learn more about working in the isolation center, COVID situation and all of those stuff, how you were able to personally navigate and handle those particular seasons. Right, thank you guys for watching. The next video after this on this series, we will be talking about, do I really think that students should continue studying medicine in Ukraine, given the current situation and with all the surrounding situations that we already have concerning the graduates of 2020, including Ghana already joining Nigeria in sanctioning, if that word is correct, certificates from 2020 from Ukraine. So we'll be looking at that. Thank you so much for watching this video. Please do like, share, subscribe, leave your comment. Let us share this video to as much people that would need it. Also in this series, let us try to also form a little community to help, to encourage those who are going through this season and those who need to make critical decisions. Let's come together in the comment section together and encourage one another and help one another. Until my next video, thank you for watching. My name remains always Edward Monoyer, and I'm still an advocate for telling medical stories and practicing the medicine that you actually love. Until my next video, bye and God bless you.